Hi, it's Dr. Sunny Desi. So I'd just like to thank you for booking in for dermal filler treatment here at Vysana in the clinic. So you've already had a consultation and we would have gone in detail about your facial characteristics, volume loss, and how dermal fillers can help with treating that volume loss. And what I'd like to do now is demonstrate a little bit about how dermal fillers are in their consistency, and it gives you a bit of a brief introduction so that you won't feel nervous, or if you've got any questions then you can email us with those once you've watched this video. So I just want to take the opportunity to talk through a little bit about dermal fillers, their consistency, the product itself, how it works, what it does. But before I do that, I just thought I'd demonstrate how it applies to the skin. Now, here we have a model of the skin that's not to scale, but it's to kind of demonstrate how dermal fillers are acting on the skin and how we're using them to treat volume loss, photo damage, and amongst some other things, those are the main ones. So here we have a model of the skin, and you can see here, these are the upper layers of the skin. So we view skin as we look and touch and feel this, but actually the skin is made up of more layers. So you've got the upper layers, which we call the epidermis, and then you've got the sort of thicker layers, which are the dermis here, and then you've got fat or subcutaneous tissue, and then you've got muscle and then bone underneath. So the idea is with dermal fillers is that we want to replace volume, but some dermal fillers can be more rigid in their consistency, so we're going to place them on the bone. Some dermal fillers will be used to volumize the dermis itself, so they're a bit more malleable, and they can integrate or infiltrate better within the dermis. And then we've got some dermal fillers that sit really high up below the epidermis, below these layers, and they are what we call skin boosters. So before I demonstrate a little bit about or demonstrate some dermal fillers to you, I just thought I'd take you through this skin picture, and it gives you a little bit of an idea of what I'm trying to achieve when I'm in clinic. So just as a recap, dermal fillers are used to treat volume loss. They can be used to treat photo damage or photo aging of the skin, and they can also be used as skin boosters, so basically injectable moisturizing of the skin. We've got the upper layers of the skin, which is the epidermis, and then we've got the lower levels of the skin, which is the dermis, and then we've got subcutaneous tissue. You can see some fat here, and then this white bit, I suppose you can call that bone. And what we're doing is, with our more projecting dermal fillers, we're injecting right down onto the bone. And that is then to lift all this up. So imagine if you're injecting dermal filler right down here, it's going to lift all these layers of skin up. So we get nice projection, we get volume replacement. If we're injecting fillers within the dermis, we're actually cushioning the dermis, sort of filling it out. And the fillers that go in here, like I said, are more malleable. And then we've got skin boosters though, that go a bit higher up. So previously, I've talked about introducing the concept of dermal fillers to you. So if you're booking for a consultation, this might be the type of dermal filler that we're using. I've got two different varieties here. One is actually a skin booster, or a very light dermal filler called Redensity 1 from Teoxane. And here we have a more projecting dermal filler. So what are we trying to achieve with this? Well, if you've already watched a little bit of the video beforehand, one is a projecting filler for volume replacement, and Redensity 1 is used to boost the skin, so basically a moisturizer, but we can inject it, so we can put that moisturizer straight into the layers of skin where it's needed. So as I was showing you before, I've got two different types of dermal fillers here. One is called Ultra Deep from Teocel or Teoxane, and the other one is Redensity 1, which is a lighter grade filler, more for treating the upper layers of the skin. So with a projecting filler, this filler it comes in a box. There are some needles in there, but I won't show those to you now. In fact, what I'll do is demonstrate the consistency of the filler. So here we have a projecting filler. So this is the kind of filler that we use injected straight down onto the bone to create volume replacement, so lifting up all these other layers of skin. So as you can see here, if we were injecting this filler right down onto the bone, it would cause a projection upwards, and we're basically creating a volume replacement. So I'm just going to make a thin linear strand. So normally when we inject this dermal filler, we inject it as a bolus, and it comes out quite thick. And you can see that it's a bit bouncy. And if I push it, it doesn't really stick to my finger. I did there because I pressed too hard. But the point is that it's got a bit of resilience to it and projection. So when we're injecting that dermal filler deep down onto the bone, then that's going to create volume replacement by helping the skin project upwards. And again, It's quite thick, almost jelly-like, and it's got a resilience to it. It's bouncy, it gives us projection. Our other dermal filler is a lighter grade dermal filler. It's more malleable, it's about integrating into the skin. And I think you'll be surprised to see how different this is in its consistency when it comes out. So this is Redensity 1. And I'm just going to put a bit of pressure on the needle and prime it actually. Push it a little bit, there we go. So there you go. That's a much lighter filler, and we use this as a skin booster. So this will infiltrate into the skin as opposed to this one that's going to create projection. This one is going to infiltrate into the skin, and we class that as an injectable moisturizer. So I've just demonstrated a more projecting filler. You can see this is quite bouncy, it's resilient, and then we have a filler that is more like an injectable moisturizer. So that would infiltrate into the skin. It's got a very smooth consistency, and that will give you a little bit of volume and plumping in the upper layers of the skin, but it will also moisturize as well. So you're probably wondering, so what's in between? Well, there are lots of different fillers that go in between as well, and I've got an example here of a filler that we use. So this would be used a little bit deeper down compared to the moisturizing filler, but it would be used higher up than the projecting filler. So if I squeeze there, you can see that as it's coming out, it holds itself. It's got viscosity to it, and again, it's not as projecting as the other one, because you can see how it settles on this mirrored surface. It's sort of squashed down. So again, we've got a projecting filler. It's sitting proud, it's projecting. We want projection with this one, it's going straight down onto the bone. And then we've got a lighter grade filler that you can see that it's just settling, it's sitting a little bit more relaxed. And this filler will be more malleable, so we can inject this higher up and not be worried about not necessarily causing lumps, but we're not worried that it won't move with facial expression. Whereas this one is very much for volume replacement. This one is there to create smoothness within the skin, malleability, but also fill out any fine lines and wrinkles. So I hope that was all very useful, and I look forward to educating you a bit more about this or answering any questions. I hope you enjoyed the Dermal Fillers intro or explanation that I just made and demonstrated. You probably have lots more questions, and I'll be more than happy to answer those in clinic prior to your treatment, or you can email if you'd like to have any more information, either email myself or kirsty@vysana.com. So I'm looking forward to treating you. As I said, if you have any questions, then please ask us, but I hope that was useful and it's made you a bit more reassured, or you felt reassured about having a dermal filler treatment here at Vysana.